normally this is what you talk. So when you talk about Q switch laser, the wavelengths are this 1064 nanometer. It's a broadly, if you see, it's an Nd:YAG laser, all right? Solid state laser, neodymium yttrium aluminum carbide, Q switch. Idea is basically that the manufacturing company creates an electrical membrane in the medium. It splits the beam, it cuts the beam into very smaller fragments. Thuk, thuk, thuk. You can hear when you fire these lasers. And these short, intense spurts of laser light, basically, you are firing at very fast intervals actually, which creates a shock wave effect. All right. So you are creating more or less a mechanical effect. You are damaging different chromophores. Normally, when you are talking about these systems, you are talking about pigment-specific lasers. All right, so these are pigmentary lasers, pigment-specific lasers, and so on. And apart from that, what else can be done is what you call the tattoos. All right, so you can do pigmentations and you can do tattoos with these lasers. All right. When you talk about pigmentations, what are the different pigmentations if you see? All right. So different pigmentations. One pigmentation is what you call epidermal melanosis. And the other pigmentation which we have is what you call dermal melanosis. So pigmentation in the epidermal layer is epidermal melanosis. Pigmentation in the dermal layer, which is not normal normally, if you see, is dermal melanosis. So there are different pigment layers or levels actually. Apart from that, what you have is a tattoo. A tattoo is a situation where probably somebody has voluntarily, the person has done that particular thing and an exogenous ink or dye has been injected in different layers of the skin actually. All right. When you talk about tattoos, if you see, tattoos are classified as professional as well as amateur tattoos. Professional tattoos are the ones which are done using professional instruments and using stabling particles, and these are injected from mid-dermal to deep dermal layer in the skin actually. So once you are done with this tattoo, it remains there forever. While another form of tattoo is what you call amateur tattoos. Amateur tattoos, if you take the history, first of all, looking at the tattoo, you will see they are not very professional. They are the sequencing is not professional. They are not symmetrical. They are done. They are faded. They are done using unprofessional instruments or needles. And normally, patient will tell you that I got it done in a village mela or something, and over period of time they fade actually. They blotch as well as they fade over a period of time. So these are amateur tattoos. All right. So tattoos, professional tattoos, amateur tattoos. Of course, it is difficult to remove professional tattoo. It is easier to break amateur ink. So amateur tattoos are easily removable tattoos. Then if you see, there is another thing which what you call the RTA tattooing, in which the person, let's say the guy was driving a motorbike, fell on the side of the road, and the skin rubbed on that particular road for a while, and then asphalt and silica particle got embedded in the skin, giving the look of something has been sprinkled on that particular area. And then the last thing is what you call the gunpowder tattooing, where the bullet has crossed the skin, closely embedding gunpowder in the skin. So broadly, but end of the day, what you need to know is professional as well as amateur tattooing, and so on. So these are the two main forms of tattooing, and these are the patients who are asking you for tattoo removal. When you talk about Q switch lasers, your end point in Q switch lasers is what you call IWP. What do you say? Immediate whitening phenomenon. All right. So what do you call immediate whitening phenomenon? Immediate whitening phenomenon. That means when you fire on a tattooed area, or a pigmentation, that area turns white. It starts to look white. If you are firing on a pigment or on a tattoo, and if it is not turning white, means you are either firing with very lower energy levels, or you are firing on an area where there is no ink or pigmentation. If you are firing on an area and you see pinpoint bleeding, that means your parameters are too aggressive. You need to lower down your parameters to reach IWP. So that is what you see is your end point when you talk about tattoo removal procedures. Alright, so broadly this is what it is. Q switch lasers, if you see. So ruby can be Q switch, alexandrite can be Q switched, and DAG 1064, and then 532, what do you call frequency doubling of 1064. Frequency doubling means half the wavelength of 1064, which is 532, and 532 is popularly known as KTP wavelength. Potassium titanyl phosphate crystals are used to cut 1064 to its half, and for that reason it is known as KTP. Alright, so KTP is actually 532, half the 1064. Q switch lasers, if you look at the indications, these are the white indications, pigmentations, tattoos, what do you see, and so on. What you see as your end point is immediate whitening phenomenon. Alright, let's say if you see in this particular slide, actually these are my Mac videos which are probably not playing in the Windows, but if you see in this particular area, when you are firing actually with a Q switch 1064, the tip is here and the distance is maintained basically, if you see, with a metallic latch. So this which you see, the latch here is just to maintain the distance. So Q switch lasers, they do not fire in contact with the skin. They fire from a gap, and when you fire, actually you start to see the whiteness on that area. So the area starts to become white, and that whitening is because of what you call immediate whitening phenomenon, IWP. There are two reasons for IWP written on the textbooks. One reason they say is you see IWP because they say you see IWP because when you are firing, the laser basically causes so when you're firing, basically when you fire on a tattoo or a pigmentation, the wavelength breaks. When you fire Q switch, it causes shock waves, so it breaks the pigment or it breaks the melanin and so on, which causes the release of nitrogen bubbles. And these bubbles, they come superficially on the skin surface to give you, with the Tyndall effect of light, that whiteness, which disappears in 20 minutes. Another textbook says when you fire this Q switch laser, the wavelength travels so fast in the skin layers, it causes vacuolization of cells. With the Tyndall effect of light, it looks whitish, but the phenomenon disappears after 20 minutes. Anyway, whatever could be the reason, but advantage is you see that IWP, immediate whitening phenomenon, when you are firing. If you are seeing IWP, you know clearly that your parameters are optimal. If you are not seeing, then the situation is your parameters are suboptimal. But if you see pinpoint bleeding, means your parameters are too higher. So you need to lower down your parameters till you see IWP and so on. All right, so that is the situation actually. Again, if you see, this is a slide where you have a Q switch laser. The tattoo which is there is a professional tattoo, and we are firing a Q switch laser. The minute you fire, that area starts to turn white. So white, 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 white. So you overlap and make that whole area turn white closely. And that is your end point when you are doing a pigmentation or a tattoo actually. All right. Now, problem is when people are talking about tattoos, your patients, they believe that probably you have a laser which will erase. They are thinking that probably doctor is going to erase that thing. They are thinking you are erasing that thing. All right. They are thinking you erase. You have a laser and laser will erase it actually. But that is not the situation. You are not really erasing it. What you are doing is, let's say in your skin layers, when the tattoo has been done, the ink particles has been embedded in the mid-dermal to deep dermal layer actually, and so on. And if you see, the ink particles are bigger than the macrophages. They are bigger than the macrophages, so the macrophages won't be able to eat them out. But when you fire the Q switch laser, when you fire your Q switch laser, you create a blast off. So you break that pigment into smaller pigment, and now the macrophages will eat out. Now they will eat, and remove them through lymphatics. Let's say you did if you fire on a tattoo on the upper shoulder, and after a couple of weeks, if you do a lymph node biopsy, you will see the broken ink particles in the lymph nodes confirming that what you broke is being mobilized. All right. So what does that mean? That means it will take some time for clearing the tattoo. It will not happen that you start to fire every week, so you will be able to remove it faster. Not. You will end up creating a complication like scarring, pigmentations, and all. So that is what is not needed actually, and so on. So what is important is. So what is important is you make these patients understand that if we have to have a gap of at least 4 to 6 to 12 weeks. If you go by the book, the longer is the gap. The longer you give the gap between the sessions, the better would be the healing, the better would be the clearance, and lesser would be the chances of what do you say, lesser would be the chances of any complication actually, and so on. So it is important to give good gap between the sessions when you are doing tattoo removals and so on. Alright, so these are the different types of tattoos which you can see: professional tattoos, amateur tattoos, and traumatic tattoos, and gunpowder tattoos. Professional and amateur are these two other form of tattoos which you see actually. All right, and professional tattoos certainly, because they are professional, inks are stable, they are done in a deeper skin layers, so more number of sessions certainly would be required. But still, in our part of the world, a lot of people, they would have these amateur tattoos. You must have seen these women having these bindis done when they were kids or something, and some marking done when they were there. So these are all amateur tattoos actually. All right. Otherwise, if you see for green inks, ruby is considered to be an ideal Q switch wavelength. Alexandrite blue black and NDI 106 for blue black or green, and 532 for red and related colors. But understand, you won't find anything beyond this. So end of the day, whatever you can do is you will have these two wavelengths. Nothing much. You won't be having ruby, you will not have Alexandrite. Anyway, you don't need Alexandrite. So on. So the limitation is, if you have a multicolor tattoos where you see a lot of colors, so then clearly you cannot remove all these colors. So you need to make patient understand that you can probably reduce it, but it is impossible to remove the whole tattoo there. So sometimes it's not a bad idea if you tell the patient it's not possible actually. Fortunately, again, most of the tattoos which we see in our part of the world, whether professional or amateur, are blue-black tattoos and so on. All right. So immediate whitening phenomenon are important, and tattoos which are older than a year. Older tattoos are better tattoos to be removed actually. So let's say somebody got a tattoo done and the person comes to you 2 weeks later that, doc, I do not like this tattoo, can you remove it? That's not a good idea because the ink has not been stabilized. And if you fire your Q switch lasers on these areas, the problem is because of inflammation, you might end up into complication of hyper or hypo or scarring and so on. So these are the common pigmentation, common complications which you see actually, and so on. All right, so it is important to understand the limitations actually and so on. All right, so these things. All right, and apart from this, as I've told you, in multicolor tattoos, sometimes you do or prefer to do a patch testing. The reason being, these multicolor tattoos can have iron compounds. Lot of tattoo makers, they use iron compounds to give tattoos whitish color or skin tone. All right, so let's say you have this spider actually, and you feel, all right, so looking at the spider broadly, you feel that probably that the skin color which you see between the legs of the spider, you feel this is a normal skin color, but you are mistaken. Probably this guy has injected iron compounds to give skin tone or white tone. Once you fire this area, the problem will be the iron will change from ferrous to ferric, and this area will become jet black. So the whole tattoo will change the shape actually. So that is not desirable. So with multicolor tattoos, you need to look into it that iron compounds, if they are used, you should not be firing any laser there. All right, because with your laser, they will change color from skin tone or white tone to black, and you can't remove it with any laser there. Apart from that, normally before doing a tattoo or a pigmentation with Q switch lasers, you cover this area, you apply a topical numbing cream under occlusion for 45 minutes to 1 hour, and then you remove it, then you clean it, then you fire. Once you are done with the procedure, you can clean that area, you can apply antiseptic creams, and you can apply topical steroids. All right, of course keeping it open, not occluding it, and so on. Advise the patient to not to expose these areas to sunlight, and physical protection is important. All right, so let's say the one situation where immediately amateur tattoo, immediately after a Q switch laser and so on. In this slide, if you see, the pigment has gone. Actually, 3 sessions of Q switch 1064 has been done, and this is the last session, 6 weeks after the third treatment. This is what you see. All right, so 1.5 months after the third treatment, what you see, still something written there. But the problem is, what you see written there is not a tattoo actually. That's a PIH, post-inflammatory hyperpigmentation, because this patient has exposed himself outside in the sun post procedure. So you ended up breaking that ink particles, but the PIH made something written there, and so on. So it is always advisable to advise your patient not to expose themselves, keep that area physically covered, use sunscreen and all. Butterfly gone, and green inks are a little difficult to remove compared to the blue-black inks. And in this particular slide, if you see post-trauma, the carbon particles got embedded. So you see them once you fire, then after, basically what you see, a minimal small patch of hypopigmentation, a smaller patch, which is still better than what it was earlier, and so on. There is a technique, what you call R20 technique in Q switch lasers. R20, repeat or rapid 20 technique. Idea is you fire one time on that tattoo and you wait for 20 minutes. Once you fire first pass, you will see immediate whitening phenomenon. All right, so the area turns white, immediate whitening phenomenon. You wait for 20 minutes, that phenomenon disappears, that whiteness will go away, and then you fire again. No IWP. You wait for 20 minutes, fire third time, you wait for 20 minutes, fire fourth time, that is R20. Normally, if you see, R20 could be very aggressive actually for a normal patient, you won't be really able to do it, and so on. All right, so 4 treatment passes are given at an interval of 20 minutes. All right, so the idea here is like these young guys who are coming to you and saying that people who are getting recruited in the armed forces, and if I'm sure you must be knowing that the Ministry of Home passed a norm many years back that anybody joining the armed forces should not have tattoos on their bodies. And now even these girls who are joining the airlines and all, they should also not be having tattoos on their bodies. So they'll be asking you and they'll be coming to you and telling you, doc, cut it off. All right. Because most of them would not be knowing that it can be done with a laser or something and so on. So, but normal situations is too aggressive actually. You won't be really able to do it. What you can do it is you can modify it in a way where you can fire once, CIWP, wait for 20 minutes, fire again, and that's it. All right, so on. Because the trauma would be very higher actually and so on. So when you say pigmentations or pigmentary lesions, one is epidermal pigmentations, and these are some examples of epidermal pigmentations: freckles, lentigenes, epidermal melasma, cafe au lait. So all, I'm not saying these are the indications where you fire Q switch. I'm saying these are examples of epidermal melanosis. And these are some example of dermal melanosis: dermal melasma, nevus of Ota, Ito, and Hori. Bilateral Ota is Hori. You must have seen people with bluish skin on their faces, and the sclera is also blue. All right, what do you call the birthmark on the face, which is nevus of Ota. All right, and bilateral Ota is nevus of Hori actually. Ito is on the shoulders actually, and so on. So I would say melasma is not really my favorite thing for Q switch lasers, but certainly Ota, Ito, and Hori responds very well to Q switch lasers. While freckles and lentigenes is a very good idea, but epidermal melasma or cafe au lait, I will not go straight with Q switch lasers and so on. If I may ask you that which wavelength for which one? 532 nanometers, 1064 nanometers, which one? So this one for deeper penetrating wavelength for dermal melasma or dermal pigmentation, I'm sorry, and this one for epidermal pigmentation, superficial wavelength for epidermal pigmentation. But yes, sometimes people are afraid to use 532 because you know that 532 shorter wavelengths are stronger wavelengths and so on. All right, so this is the situation and I hope you remember. So this is one example of nevus of Ota, and you see after multiple sessions, it has substantially changed. And this is not beautification of a person. This is just not cosmetic, because every time you say cosmetic, people, they think that idea of cosmetic is to make somebody beautiful or look better or look something like this or that. But here's this person who has seen or who has undergone all that social trauma because of that thing on their faces all these years. If you change it, this is a life-changing thing for them. All right, it's not just cosmetic. So lentigenes gone and so on. Apart from this, what is there is what you call laser toning. So laser companies which are manufacturing Q switch lasers, they'll give you one wavelength which is Q switch 1064. They'll give you another wavelength which is Q switch 532. They'll give you a third tip, and the third tip which they will give you is 1064, but in a bigger spot size. So they will give you a big spot size, 1064. And this wavelength 1064 in a bigger spot size broadly does not need any numbing or something, because the energy is not falling on a smaller area, so it will not really have a mechanical effect like that. This tip 1064 bigger spot size is given the name laser toning tip or rejuvenation tip, or they are saying actually this what do you say, carbon peel or peeling tip. All right. Why carbon peel? Because you can apply carbon on the faces and you can fire this bigger tip, and fire, this carbon will fly off and you will see the clear skin. Of course, you can do it without using carbon or activated charcoal or carbon creams also. But the advantage of using the carbon creams or activated charcoal is that easily you see what all areas you have fired and what all areas are left and so on. All right, so that is what it is. So idea of laser toning is your wavelength 1064 with a bigger spot size which you are firing is penetrating in the dermal layer. It causes heating up effect in the dermal layer. So heating up effect, minimal heating effect will cause collagen remodeling, shrinking of the pore sizes, so less oily skins. So patient will feel, or they will like the skin better. Apart from that, women generally they bleach their faces because they feel that hair on the face gives that tinge actually. So once you bleach or once you fire the Q switch 1064 basically in a bigger spot size toning mode, you bleach the hair on the faces of these women. So immediately post procedure, once you clean the face, they will like it. The face would, they will say, would be glowing. They will say that it is looking fairer. But the idea here is you have actually bleached the hair. So you're not really supposed to fire on a male patient's face where you have the beard and so on. All right. Apart from that, the last thing which you talk of with these systems is they claim sometimes that you can do hair reduction with them. Q switch laser manufacturers sometimes they claim you can do hair reduction also. But understand Q switch laser 1064 cannot cause photothermal effect like a diode laser or long pulse NDI. They are photoacoustic, not photothermal. So what you are doing is you are creating a shock wave just to remove hair out of the follicle. So there will be a transient delay in the growth. So that is temporary hair reduction, and that is just because of the shock wave hair follicle coming out of the hair follicle. That's it. So hair coming out of the hair follicle. So there is a delay actually. That's what it is, and so on. So that is for your Q switch lasers when you talk. All right. So any questions so far?